Terrific. Good afternoon, everyone, and thanks for joining us today for another Cuyahoga County briefing. Today, County Executive Armin Budish, Board of Health Commissioner Terry Allen, and Board of Health Medical Director Heidi Gullett are here to brief us all. We'll have time for a couple questions at the end, I hope. Armin, thank you.
Thank you. Good afternoon. I want to begin, as always, by thanking Commissioner Allen, Dr. Gullett, and all the Board of Health for their good work. Every week they come before you and provide important data that should help you to understand why it's so important to wear masks, socially distance, and quarantine yourself if you've been exposed to COVID or if you have symptoms. Every week, as the Board of Health comes before you, you can see their sincere passion for their work. I've been especially moved by Dr. Heidi Gullett's moments of gratitude. And I'll tell you why. She shows us that we can find bright spots in our lives, even in the midst of our most serious crisis, when we're challenged beyond what any of us thought possible way back in early March of 2020. Maybe it's knowing that you're saving lives through your work, like the Board of Health does, and like our nurses, doctors, and other health workers are doing every day. Maybe it's getting outside and enjoying the beautiful trails and the lake that our county offers, and offers it for free. Maybe it's missing people you love, like your parents, kids, or grandparents, because you can't personally connect with them, but you still appreciate in the deepest sense just how much you love them. Whatever it is, now is the time to call up those moments of gratitude, just as Dr. Gullett does for us each week, because that's what will sustain us in these long days ahead. What sustains me is knowing that the work we're doing is keeping people safe and helping them get the supports they need, like food and economic assistance. The needs that people have are growing at an exponential rate. Just last month, our Department of Job and Family Services, which helps people get their benefits, saw a 100% increase in applications for food assistance. That's a 100% increase. This is terrible, especially because this doesn't have to be. If Congress could put aside their differences and please help the people who are flooding our call center, if they could find it in themselves to come together with the greater good and reinstate unemployment benefits, we know that thousands upon thousands of Cuyahoga County residents would be able to eat, to stay in their homes, and to feel secure as they look for another job to replace the one that disappeared when the economy shut down. I want you to know that I'm on the phone weekly, sometimes more often, with our governor, our senators, with our U.S. and state representatives, and other leaders to state our case, to explain that our residents need help. And we've seen some positive results. One of the positive actions that our federal government took at the outset of this pandemic was the release of a stimulus check that almost every U.S. citizen could get. These checks, which were $1,200 for individuals that make $112,500 or less, and $2,400 for married couples making $115,000 or less, those checks were mailed out to people who had filed a tax return in 2018 or 2019. But what if you don't file a tax return because you don't have any income? A lot of people don't know this, but you're still eligible. There's a whole group of people who are eligible for these payments who have not gotten their checks because they didn't file a tax return. This group represents the most vulnerable among us: minorities, people in poverty, people with low levels of education. How many people are we talking about? There are 12 million across the United States. That's right, 12 million people haven't gotten their checks. That's more than $14 billion that's gone unclaimed. How many in Ohio? 394,000 in Ohio have not received their checks. And since Cuyahoga County is among the most populous counties in the state, and one of the poorest, you can be sure that there are tens of thousands of Cuyahoga County residents who are eligible for a $1,200 check who have not received one. I'll repeat that. Tens of thousands of people right here in the county are out $1,200 that they're entitled to receive. That's millions and millions of dollars. So what are we doing about it? We've partnered with United Way's 211, Greater Cleveland Food Bank, Legal Aid, Enterprise Community Partners, and the Cuyahoga Earned Income Tax Credit Coalition to make sure that those who are eligible to receive these payments will get them. This is very important. You may be missing out on $1,200 or $2,400. If you have no income or your income is less than $12,200 and you did not file a tax return, you may be missing out on claiming your money. If you have internet access, you can apply today using the non-filer's Enter Payment Info Here tool. Now that's a long URL and it's on the screen. If you can't remember it though, or you don't have easy access to the internet, or if you just need more information and assistance, there's an easier way. Just call 211. Again, you may be missing out on money that the federal government has pledged to you. Call 211 for more information if you think you might be eligible. The deadline to apply is October 15th, and you should receive your money before the end of the year. Okay, now speaking of deadlines and the federal government, I want to raise a very serious concern. Just this week, the Trump administration announced that they were moving up the deadline for the 2020 census count by 1 month, from October 31st to September 30th. Now, why does that matter? Well, it's because our count, the number of people who respond to the census, determines all sorts of things. The census determines how much money we receive for benefits, for food, housing, and health care, how much money we get for early childhood education through Head Start, benefits for our elders, and a whole lot more. Allocations of hundreds of millions of dollars are set by the census. The census even determines our representation in Congress and in the State House. And we have to live with this number for 10 years. There isn't a do-over. The Trump administration cut the time for the count by a crucial 4 weeks, and they're pulling the census workers early. Now, these are the folks that go door to door to help people fill out their census forms during the last few weeks. Typically, the very end of the census effort is focused on the hardest to count people. These are minorities, young children, immigrants, the poor, the very people who need the most help from the programs that the census numbers impact. The census is a nonpartisan activity. The numbers don't care if you're a Republican or a Democrat. What can you do about the shortened census period? It's simple. Fill out the census form now. It's just 12 questions. It takes less than 10 minutes. You need to make it a point to answer these simple questions. You matter. But if you aren't counted, you may lose out, and to be honest, we all will lose out. There are lots of ways you can fill out the census, but here are the 2 easiest. If you don't have access to the internet, use your phone. Call 844-330-2020. You'll go through some automated prompts. You'll be done in minutes. If you can access the internet, you can go to my2020census.gov. That's my2020census.gov. It's quick, it's easy, it's confidential, and it is critical that we do this. Please fill out your census form. Finally, I have one last comment. Usually it's a bad thing when a politician flip-flops. But when Governor DeWine tested positive for the coronavirus and then flipped to test negative, well, that's a good thing. Governor, stay healthy, please. We're grateful for your leadership and your courage during this crisis. Thank you.
Thank you, Armand. And we appreciate the partnership with the county executive. And we're also very happy that Governor DeWine is free and clear now in his latest tests. And so we think that's positive news as well. So we appreciate hearing that. So today we'll provide an overview as we do with our local issues, followed by our medical director, Dr. Heidi Gullett, who will discuss some hospital trends, some testing data, and some other related information. So this week, we continue to see widespread transmission of COVID in Cuyahoga County. As you may know, the county still remains in the red, risk level 3 in the governor's COVID risk rating system. Risk level 4 is the highest level, purple. And so we're considered to be at a point where transmission risk is high in our community. As of yesterday, countywide, we had over 13,000 cases, 13,141 cases of COVID-19 reported in Cuyahoga County, including the city of Cleveland, with 16.5 of those cases requiring hospitalization, which is by far the highest hospitalization number in the state, 2,177 Cuyahoga County residents. A total of 3.7% or 491 of those total number of people that were COVID positive have died, all in the last 5 months. By comparison, we've had an elevated rate of influenza in our community. We had an elevated rate of influenza in our community during the 2019-2020 season, and we saw less than 50 fatalities in 6 months. 491 fatalities from COVID-19 in 5 months compared to 50 fatalities from flu in 6 months. This is a serious, serious virus. It's clear that the coronavirus spreads easily among people without symptoms, or it can be spread easily by people that don't have symptoms. They can unknowingly transmit it to others. That's the risk of this virus that we need to watch out for, which is why masks are so important. We continue to see cases in non-congregate settings out in the community. We've experienced a range of clusters in childcare environments and long-term care facilities, backyards and house parties, return to play sports, weddings, funerals, and among family, friends, and the general public. We've learned that people move widely across the region and beyond, with exposures often happening outside of the immediate community where a COVID-19 case may reside, demonstrating the interconnectedness of Northeast Ohio with the rest of the state and the country. Masks, social distancing, remote work, surface cleaning, hand hygiene, they all continue to be key prevention activities. On July 30th, the Cuyahoga County Board of Health released COVID-19 recommendations for K-12 schools in our health jurisdiction, which is the schools in Cuyahoga County outside of the city of Cleveland for the upcoming school year. In the guidance we released with support of our Board of Health members, we recommended that schools begin the 2021 school year operating remotely and that schools discontinue sports and other extracurricular activities during the remote learning period. We recognize that education and extracurricular activities are a very important part of children's mental and physical health. We also understand the importance of resuming in-person activities when it is safe to do so. We continue to work closely with our partners in the school districts, and the facilitation of the Educational Service Center of Northeast Ohio has been critical in those discussions. In fact, we just met with them this morning, meeting at least once a week. Since the release of the recommendations, we've received hundreds of emails and phone calls from the school community, many more than we could respond to individually. I want to thank the school community for sharing their thoughts and feelings. We appreciate the input that has been shared during what continues to be a very difficult and unprecedented time amid the pandemic for all of us. Please know that we have read each of these emails to understand how our recommendations impact individual families and individuals amid this global pandemic. We've been moved by the heartfelt statements and circumstances described in those messages, and we respect and appreciate all the opinions that have been shared. In response to this important feedback, we provided additional information on our school guidance website yesterday to provide some background on our position. I'll provide some key points from that communication. The central challenge in our community response to COVID-19 pandemic has always been, first and foremost, to save lives. As I mentioned earlier, we've lost 491 Greater Clevelanders to date across the county, ranging from age 33 to 103. Friends, family members, neighbors, coworkers have all died from this contagion. With the end of COVID-19, unfortunately, still not clear in our sights. Tragically, the death toll will continue to rise. The only way to blunt the pace of these deaths is to adopt a strong county-wide focus on prevention. All our preventive activities, including those of individual students, staff, families, coupled with the ability of schools to provide safe learning environments using protective strategies, will also, all these will have a major impact on the viability and safety of schools and extracurricular activities, including athletics. Transmission that may occur in these settings also has the potential to spread elsewhere in the community, causing future surges in COVID cases. I want to talk a bit about testing, and Dr. Gullett can elaborate on the big picture as well. A key element of the response to the pandemic, and specifically to the outbreak settings, such as schools, is testing. And at the present time, there's major limitations in testing availability for our community, and particularly with regard to testing kids. It's very difficult to be tested if you're asymptomatic, and generally it's very difficult to be tested if you're a child. We've been advised by numerous lab and governmental partners that this is a national problem and isn't likely to change in the coming weeks and months. There are a number of new testing platforms out there that are still being worked on and maybe in the supply chain coming forward, but we don't have them now. This limited testing availability also creates unique challenges in guiding decisions on isolation and quarantine. Thus, our team will have to defer to monitoring symptoms when managing suspected case and outbreaks. Our school districts review the recommendations in their plans, and we recognize and respect their responsibility to make decisions that best meet the needs of their respective school communities. To be clear, these are not Board of Health orders we put forward. They are recommendations designed to provide evidence-based guidance. These recommendations were developed in response to requests from many school administrators for public health guidance. And we understand that the school districts may exercise their discretion as they work through their final decision processes. And we understand that they may choose a different path. But as always, we're committed to work with all the districts as they implement their plans. And we recognize that students learn most effectively in the classroom. And there are times when a student's education needs necessitate that services are delivered in person. These may include special needs education, extracurricular activities, or other school services. In order to maximize each child's learning, schools are permitted per state guidance on mass gatherings to have small groups of students report to school to receive their services during distance learning. Groups should be no larger than 10 in those circumstances. White House Coronavirus Task Force Coordinator, Dr. Deborah Birx, and the CDC Director, Dr. Robert Redfield, are urging people to follow public health guidance as reports of new cases of COVID climb in the U.S. Due to concerns about rising positivity rates among those tested for COVID-19 in Cuyahoga County, we were recently asked to participate with other Midwestern counties on a White House call with Dr. Birx to discuss these concerning trends. Recently, on Sunday, August 2nd, Dr. Birx warned the country that we have entered a new phase of the pandemic, stating that if you have a high caseload and active community spread, just like we are asking people not to go to bars, not to have crowded bars where they don't social distance and people aren't wearing masks, and not to have household parties where you can spread COVID-19 where people aren't protecting themselves, not to create large spreading events. We're asking people to distance learn at this moment so we can get this pandemic under control. We face these significant challenges even as flu season is just around the corner, and we anticipate that COVID-19 and flu will circulate in our community at the same time. We remain committed to continue providing guidance to our schools and their partners during the pandemic response. And CCBH will continue to support schools by providing surveillance, outbreak investigation, and contact tracing for any outbreaks that are detected in the school environment. As we move forward and consider any future modifications to the recommendations, we'll consider a range of factors with our school partners to track the status of the pandemic. And we discussed these with our school administrators this morning. We'll look at our positivity rates. And we want to see a sustained decline of COVID-19 testing positivity rates below 5%. New York City reports their positivity levels are about 1% right now in the city of New York, which is fantastic. It's something for us to shoot for. In terms of new case reports, we need to see a sustained decline in new cases over a month period as we've seen a major surge over the last month. In our jurisdiction alone, we're still seeing over 100 cases reported every day. Looking at the state public health advisory system, a risk rating of orange or level 2 would need to be attained and sustained over multiple weeks, which includes sustained improvement in the metrics that relate to our health jurisdiction specifically. And lastly, we have the remaining concern about testing capacity for kids, as there is little to no testing capacity available for those under the age of 18, which dramatically complicates our outbreak response in the school setting. Lack of testing limits our ability to respond, and we're forced to use a symptom-based investigation response. So I remain hopeful that we can limit the scope and magnitude of this unprecedented pandemic if our community embraces the prevention guidance, including broad use of masks, staying home when you're sick, social distancing, remote learning, and school and job work where possible, and following cleaning and hygiene guidance. As always, to our incredible staff, partners, and all the people in Cuyahoga County that are living through the challenges of this pandemic, I thank you for your partnership as we live through this unprecedented coronavirus pandemic. And at this point, I'd like to turn things over to Dr. Gullett. Thank you.
Thank you, Terry. So I got this new mask and it says doctor's orders, and underneath it has a mask and it has a 6 and a pair of feet. And the reason that I share that is that, many of you know I'm a public health physician, but I'm also a family physician with a clinical practice here in the community. And a lot of what we learn how to do in medical school is to treat illness, to treat disease, to use medications and procedures to do that. But one of the most important things that we do in medical practice out in the community is prevention. And so the Ohio Academy of Family Physicians and others have put together some really simple infographics like this one to remind us that medical orders don't just have to be medicines that you pick up at the pharmacy or surgeries that you have done, but they're preventive things like wearing a mask and staying 6 feet away. So even though we've said this for a very long time, going on nearly 6 months, it's important just to remind everyone of the basics, and that masking and staying 6 feet apart really do work. And we can really report that we have definitely seen that be the case in talking to a lot of cases, and those particular cases that really have masked and stayed away from others have had a much lower transmission to other people than individuals who weren't practicing those things on a regular basis. The next thing I'd like to go into is to talk a little bit about the kind of tests that are available. In the last day, we certainly have learned a little more about testing and what we call test characteristics that help us understand why a test could be a false positive or a false negative. Given that Governor DeWine had this initial test, and as our county executive pointed out, we're incredibly grateful that it indeed was negative, and that he can continue to lead our state in this response. So I wanted to just explain that in our numbers here in Cuyahoga County, in our jurisdiction, as well as our partner local health departments across the state, we do not report cases unless they are a PCR positive, meaning lab confirmed. So there are 3 different big buckets of testing that you might be hearing about. One is what we call Pcr testing, meaning we're testing you right now for infection. Do you have the COVID-19 infection right now? And we test you by putting a swab either in the front of your nose, in the middle of your nose, or in the very back of your nose where your nose and throat come together, or for children in the throat. Then that is sent to a lab that tells us indeed that they have detected the virus or they have not. There's another group of testing that's called antigen or rapid testing. And that's what you heard was the initial test that Governor DeWine had yesterday. And that test is not considered a lab confirmed case. So anybody who has a positive for that does not get counted as a lab confirmed case. We investigate whether anyone who is positive with that test has been exposed to anyone who's confirmed positive with a PCR test, or whether they're having symptoms consistent with COVID-19. And those people typically, if they don't have those things, then get a PCR test to confirm. So I want to try to help people understand we don't just assume that any test anyway is positive. We're very careful about what we call cases. We have very specific, what we call case definitions that are consistent throughout the state. The third bucket of testing is a blood test called an antibody test. You may have heard it called a serology test. And that checks to see if anybody's immune system may have been exposed to COVID-19 and produced a response to that in the form of a protein called an antibody. So that doesn't tell us if you have the infection now. It tells us if you might have been exposed to the infection and your body might have made a response. So those also do not get counted in our case count. Those are a very different way of understanding that people might have been exposed at some point in the past. And people only ever get counted once. Even if they have multiple PCR tests that are positive, they're still only ever counted as one case. So I wanted to try to answer some of the frequent questions that we get here so that people can understand the data that I'm about to present. We can move along to the data brief at this point. Thank you, Jonathan. So you can see that we had an increase in cases of nearly 100 cases per day this past week. We had 699 new cases in total, bringing us to just under 9,000 cases since the beginning of the pandemic. We've also had nearly 1,000 hospitalizations. So those are individuals who have been in the hospital for conditions related to COVID-19 at some point during their infection. Not currently, there are several hundred people currently admitted, but this is at any point during their hospitalization or during their course of illness, excuse me. We also have had almost 250 people admitted to the intensive care unit during the course of their illness, and this does include some children under the age of 18. We are just at nearly 400 deaths in our jurisdiction, but as you heard Terry talk about, we are at the very unfortunate point of reaching almost 500 deaths in our county with data combined from the city of Cleveland. This is a very grim milestone, and we need to continue to remember these families who've lost loved ones. These are our neighbors. They were irreplaceable parts of our community. And we need to do everything we can to minimize further loss of life. And that includes things like masking and staying 6 feet away. And we appreciate everyone working really hard to do that. But people get tired of that, and we understand that. But the reality is that you are preventing other people from dying by doing these simple actions. You'll also see here that we have nearly 7,200 people recovered from the infection, and we have slightly changed the way that we calculate it. And so that's why you see the little asterisks there, but we're still monitoring the number of people who are recovered from infection, which is very important for us. Next, moving down the report, you'll see that we continue to show case demographics here. We're showing you the age distribution and also showing you male and female. And we continue to report out on healthcare workers per week. I'm really pleased to say that the number percent of cases that are positive from the beginning who are healthcare workers has dropped from the mid 30% range all the way down to a little over 17% this week, which is really important. We do continue to see a significant issue with COVID-19 disproportionately impacting people of color, and we've talked about this on many occasions. We have continued to calculate what we call a racial inequity index, which basically helps us understand how many people are getting COVID-19 when you compare individuals who identify as Black and those who identify as white. It helps us understand in our jurisdiction, so not including the city of Cleveland, how much more likely you are to get COVID-19 if you identify as Black than as white. And we've presented this before, but I can tell you that the newest calculation remains over 3 times as likely if you're Black than white to have a COVID-19 infection. Our data continue also to show that there are increased rates of hospitalization as well as intensive care unit care for more serious infections among our citizens of color here in our jurisdiction. You can continue moving down. So our epi curve, you'll see on the next page, shows how the cases have been distributed over time. And as we've done since the very beginning, we're showing from March all the way until the present. And as you've heard us say many times, recent days often look like the cases are significantly decreasing, but that's simply because data do have a lag in coming in, sometimes days, sometimes even up to a week or two. So I think what you can see is that our new cases here made a significant jump in July, which you can also see on other parts of our report that we put out every week. And so the goal is that we try to flatten this increased surge that we had beginning in July. And our hope is that it remains that we can flatten it and not get any higher than we were in July. But that is a threat, and we need to be very careful with that, which is why we try to present all of these data so that everyone can see where we're at now, where we've been, and hopefully where we don't go back to. You can continue going down to our map. So this is our weekly map. Very grateful for our data analysts who work tirelessly to make sure that these data are ready for the weekly Friday release. These data, again, simply indicate the home address of cases. They do not indicate where individuals were infected, nor do they necessarily indicate a high degree of risk in a particular zip code. We have cases in every part of our county, as we have since March, and there are many different places where transmission occurs, which you heard our Health Commissioner Terry Allen talk about a few minutes ago. You can continue onto the final page of the brief. So when looking at our hospital data this week, we've remained pretty stable with regard to adult hospitalizations. You can see on the very top, our adult medical beds remain at 79%, the blue line, pretty similar, just a little bit of a drop. Our ICU beds are exactly the same as they were last week at 81%. And pediatric beds have been going up and down a little week to week, which you can see on this graph. Again, we have graphed it since the beginning, just so you have a sense for what kind of our hospital utilization, meaning how much of our hospital beds in these four types of data are we filling up each week. And our ventilator usage is up just a little bit. So in general, we think the hospitals are sort of stable with overall utilization, but the ventilator usage is slightly up a little bit since last week, but has remained, again, between the 30 and 40 range for quite some time, not going back to where we were in April, over 55%. And then if we move on to the remainder of our report, this is a summary that we put out each week that goes over the total number of tests that are done by our 3 hospital labs here in the community that are doing COVID-19 testing, and those being in alphabetical order, Cleveland Clinic, Metro Health, and University Hospitals. And they send us their total number of tests done week to week and the percent positive, meaning the number positive over the total number of tests done. And that helps us to understand 2 things. The percent positive helps us to understand whether or not we have enough testing, because if your percent positive stays high, that is one indication that you don't have enough testing, meaning you're not testing enough people out in the community who aren't positive. The second is it helps us understand how much community spread is happening. So we are pleased that this has gone down. We had quite a spike when our cases spiked in early to mid-July. The average you see here is down to 5.4. We were at as high as this week. The hospitals report independently, so we have had a percent positive this week up to 6.4 in at least one of our hospitals. I'd also just like to help people understand that the percent positive here also includes all the people who are being tested before they get a procedure. And so those people are not tested. So we would assume those number of tests to be very low positives. So these don't reflect only people out in the community, but they also reflect all of the hospital testing too, as well as people who were tested at these hospitals who live outside of Cuyahoga County. But it is still helpful for us to track. We're just over 20,000 tests this week, slightly down from the number 22,000 the prior week. So with that, we'll conclude the review of our data. And I just would like to finish with a moment of gratitude, as I normally do. And I'd like to really focus on some individuals who have spent greater part of the last 5 months on the phone. So those are our call center staff, who actually come from every part of our agency here, who staff our call center all the time, and who have had a very high call volume at times from the very beginning. And we have several leaders who supervise in there and make sure that it's running smoothly. But we just cannot thank you enough for being the voice of our agency and the first trusted source of public health information that people reach when they call into our agency. And then I would also like to share gratitude for our partners at United Way 211, who are also answering quite a few calls from the community and they've been partners since the beginning, ensuring that the right COVID information was programmed and that the calls got to the right people from the very beginning. And as you heard from others today in today's press conference, continue to answer the phones and do it in a way that serves our community in a really meaningful way. So we thank all of you for your continued service and really appreciate all that you're doing for our community. With that, I will turn it back over for questions.
Thanks, Dr. Gullett. This is Mary Louise Madigan from the county. If you have a question, just identify yourself and tell me to whom you are directing it. Anyone?
Yeah, hi, Mary Louise. This is Roosevelt Leftwich from Fox 8. I want to direct my question toward Director Allen. If I could, you mentioned that you were talking about the schools and the recommendations here as far as making those recommendations, just that recommendation. But several districts are allowing extracurricular activities. Some districts are also allowing for in-person class hybrid models. Can you give us an idea of whether or not the county is ready or is in some case anticipating that you might get further spread of COVID-19 by having all these children interacting with each other, whether it's on the field or eventually in the classroom?
Well, thank you for your question, Roosevelt. Indeed, we're certainly concerned about any outbreaks we have in the community. We have had an ongoing dialogue with our schools, I think going back to graduation, when folks were trying to figure out how to safely let seniors celebrate with their families in graduations and work through a range of guidance with them on ways to do that in a safe way, in a way that they can celebrate and recognize the moment. And they were incredible partners, as they've been from the start. We also recognize that we have had in school, we have had sort of back to school, sort of back to play sort of sports situations where we had concerns about cases. And so what we've been doing is talking with them from the beginning. We recognize and certainly respect the rights of districts to decide what they think is best for their school population. We put forward recommendations, and as I said, they're not board orders. And so we respect what they choose to do, and they'll use their discretion. What we do plan to do is to continue to work with them to educate all the districts around issues around food safety, around how case investigation and contact tracing works. And if they do have cases in the school environment, how we'll work with their school health facilities and their leadership to respond. And so certainly across the board, we've had outbreaks in all kinds of settings. We know about long-term care. I've described weddings, funerals, people coming back from Florida, from Texas, and bringing it back from vacation. Bars, restaurants, we've had lots of outbreaks. And so certainly we have that concern. We know that schools are taking this very seriously. There's guidance from the Department of Education that they're following, and they've been listening to the guidance that we provide. And so they're going to do the best they can based on the decisions that they feel they have to make. And we'll continue to partner with them as we have from the start, because frankly, we're all in this together.
But overall, your recommendation is that if you can go to remote learning, and if you can stay with no extracurricular activities, that is the best recommendation you guys have at this point to prevent current spread among student population.
Yes, that's right. That's our current recommendation. We are, as I mentioned too during my comments, tracking a number of of metrics in the community. So we are looking at that positivity rate. We want to see it move below 5 and stay below 5. It would be great if we got close to where New York City was at 1%. That really reduces the concern and risk about large numbers of people moving around the community that can potentially transmit. Also recognizing that CDC says the rates of cases that are confirmed, the actual number of cases in the community are actually 10 times higher. People that never get tested for one reason or another are unable to be tested. So we need to think about those risks. We're also looking at this, our case report data, our weekly case report data, and we have been elevated. We're seeing cases over 100. And so we're going to continue to watch that. We like to see a sustained decrease in cases over, multiple weeks to show us that the masks are working, that people are taking precautions in the work environment and in bars and restaurants and in their backyard parties. I would relate to that, what happens in the house can translate into the school environment. So you may go to work and you wear a mask and you social distance, and surfaces are being cleaned, you're washing your hands. When you come home, you need to maintain the same level of safety among your family members because the same risks exist everywhere. So from our standpoint, we're going to track that along with the 2 other things, as we mentioned, the rating system. So we want to be at least level 2 or below that's level 2, which is orange, for multiple weeks sustained, because that takes into account, 7 metrics around hospital data, a range of case-related data and other trending information that's critical. So we think that's important. And then lastly is this testing piece that I can't emphasize enough. Our concerns about the ability to test children in the community during a situation where we need to have rapid testing quickly. And so that means we may need to, fall back on this symptom-based assessment. So we'll be checking with symptoms like cough, fever, shortness of breath, loss of taste or smell, sore throat. There's a whole constellation of symptoms that we've seen talking to many, many cases over the past, many months, 5 months. So yes, we understand that. We certainly think that, and have seen, by the way, that many districts are choosing to go remote and also are withholding sports, and some are choosing some hybrid, and some are choosing to go forward in other ways. And we'll work with them no matter their choice. And we're going to continue to provide some guidance where we think appropriate throughout the pandemic, as we have, from the very beginning.
All right. Thank you. Thank you, Terry.
Thanks, Roosevelt.
Thanks, Roosevelt.
Hey, Mark Ackerman from WEWS.
Hey, Mark.
Hi. Question about last night's event. We've heard now that 6 additional staff members from the Shoreby Club also got the rapid test and tested positive for COVID. How many people total tested positive with the rapid test? And then have any of those people also had a false positive or false negative?
Yeah, thank you for your question. I will answer to the best of my ability. We work really carefully to understand anytime there's a concern about multiple cases. What I will tell you is the rapid test is the antigen test, and it is what Governor DeWine had and what the cases that you have just mentioned had done. So we were notified this morning about 6 individuals who had positive rapid tests who worked there in advance of the event. They are employees there. And so my understanding is that whenever the president goes somewhere, people get rapid testing before they would have the opportunity to interact with him. So we were notified about this and talked with the appropriate staff there about how to get testing done for PCR. So again, these are not cases. These are rapid positive antigen tests that are concerning. So we recommend people who have one of those be isolated immediately and then get a test in a safe way. So, a drive-through test where the staff have on PPE. So we gave the staff feedback about where they can have those tests done. And we have not received any follow-up yet. So we've given the best guidance we can, and out of abundance of caution, walk through all of the infection control practices we do, just like with every other event and organization and location. But that's a part of the reason I spent a few minutes at the beginning of my remarks trying to differentiate the kinds of testing that are available, so that people also know when they see our statistics, they can be assured that we have not included any that are rapid testing, which actually are not actually meeting our case definition for a COVID-19 infection.
Thanks very much.
Did CCBH have any sort of presence last night at the Shoreby Club after 6 people tested at least preliminarily positive? Was social distancing and all those other things that we like to talk about maintained within that event, and did CCBH monitor that?
So those individuals were tested, from what we were told, were tested before any people ever arrived, and not even tested on site. So those would not be individuals who would have interacted with anybody at the event. That is, the same is true for our governor. He was tested well in advance of meeting our president on the tarmac, which would have been the normal process. So those individuals were not, a part of that. But I can tell you that walking through infection control, we were very appreciative of everything that this organization has done, just like hundreds of other organizations who've been doing social distancing, who've been doing consistent masking, who have been doing the right environmental cleaning and controls. That's precisely what they told us as we walked through this with them today. But just to understand the flow is that people who got the rapid test don't actually interact with anybody until those results return, and then they're prevented from interacting at that point.
Thank you, everyone, as usual, for joining us. And if you have any questions, you know how to get a hold of me. Armin, Terry, Dr. G, thank you.
Thank you.